on the NewsChannel 5 network. This is Open Line.
Good evening, everyone. Rory Johnston in the Open Line chair tonight. We are live on a Wednesday night here on NewsChannel 5 Plus, and we hope that you're having a great evening and that you will join us for an interesting discussion. It is the first countywide health assessment in nearly 20 years here in Nashville, and it's really revealing some interesting details about what's happening with health care here in Nashville among all of us, and we're going to go through it with our guests tonight. We want to welcome Samni Areola. Did I get that right, sir?
Yes, you did.
Samni, thanks for being here. He is the Deputy Director of Health for Metro Public Health Department, and Tracy Buck is with us, the Director of Community Development and Planning. Thanks for coming in after a long day at work to talk about this. I'm just getting my first look at it. I'd read a summary earlier today, and specifically we're going to talk about something that was revealed in this survey about Latinos here in Nashville. So we're going to kind of hone in a little bit, but let's start broadly about how this health and well-being survey came about. Okay. Samni?
One of the things that is important to health is that we have an understanding of the status of health in the city.
Right.
Even with all of the efforts that we put forward, there are pockets and gaps that we have to be able to identify. And so one of the ways to do that is as an assessment like this. And quite often when we have data, we don't typically get those data at a sub-county level,
right?
Zip code or targeting specific demographics. So this data allows us to do that. And part of that is working with Senator Frist and Nashville Health to plan this and to have one of the best companies, institutions that do this across the country, do the assessment for Nashville. And it really does give us what we think we need to be able to pinpoint those pockets and gaps. And you mentioned one of them in terms of health insurance disparities in the Hispanic population. We also have other chronic diseases there that we see some disparities along geographical areas, along certain demographics, along socioeconomic status, along race. All of those things are important for us to be able to make the interventions that are needed to improve health for everyone in Nashville.
And that's the bottom line here is now we have this kind of a data point, a bottom line where we can really look and assess. This is right now here in Nashville. Tracy, he mentioned Senator Bill Frist, founder of Nashville Health. Tell me a little bit about that group and how they got involved.
So Nashville Health has been a partner with the health department for several years since their inception. And they are able to kind of bridge the gap into some of the healthcare space. They have partners that we have not previously really been able to partner with. So they were able to bring that expertise to the table to help us, do some fundraising and raise the necessary funds to do this survey.
How new is this? This just came out recently, right?
This survey,
the results?
Yes. The survey was actually in the field from October of last year through April of this year. And the results, we just made them public last week.
This really breaks down a lot, Samni, as you mentioned. There's a lot of information we want to share with you, and it also compares us to peer cities like Charlotte and Austin, growing areas similar to Nashville, where we stand. One of the key things that I saw right away is, and it's good news to see that 90% of Nashvillians currently have some form of health insurance, which is great. But as we start to break down, we see different groups, and you look at economic levels and how that changes. And I think in the last year, we've had more and more people uninsured. Is that right?
That's what's been in the
big increase
in the news. Yes, a few people have been, for different reasons, lost their insurance, and access to care and insurance is very important. One of the things that we say is we know the things that work for health, and even the partnership and collaboration with Nashville Health. It's very important to understand that health is very broad, and as the local health department, we are critical, we are central, but we can't do it alone. And so we need to work with partners at the state, at the local level, at the federal level, private, public entities, to ensure that we get as many people insured as possible. But you'll also know in another study which is very important, to not just look at the overall aggregate, to drill down. If we did not drill down, we will not be able to see the disparities in the Hispanic population of uninsured Nashvillians. Similar to what we found doing what we call scale, which is sub-county analysis of life expectancy, where overall we seem to be doing very well. But when we drill down, we see disparities approaching 20 years between two different parts of the city.
Right.
So this kind of data, where you get to zip code level, is very important, so we can again know what the disparities are, try to understand factors that are contributing to that, and then see ways that we can improve it.
Are there some results here that kind of raise some eyebrows, that kind of surprise people, or were they about what was expected?
I think the one that surprised many of us, including the researcher who led the study, was the smoking rates. And that is something that the health department is responsible for addressing. We lead out on the tobacco cessation efforts here in Davidson County. And that number is much lower than what is normally reported by the CDC for Davidson County.
Right. 13.2% of Nashvillians report that they're current smokers. And what's interesting is when you break this down, you look in the East Zone, as we call it, many more people appear to be smokers. 26.3% compared to 6.5, 8.99.
Right.
And then we go into vaping, e-cigarettes, which have been in the headlines quite a bit.
Yes.
Almost 7% of respondents said they were current users of e-cigarettes or vaping products. 18 to 29, as not unexpectedly, more people reported vaping than smoking.
And when you dig even deeper, when you look at the e-cigarette and vaping use, if they use it every day and then they use it sometimes, or not every day, the every day doubles for every demographic. So I mean, the sometimes use doubles over the using every day. So people are just starting to experiment with the vaping. Right.
Okay. Obesity is also another one I'm looking at here, a challenge for the city. 2/3 of Nashvillians are obese or overweight, and comparatively, that's about 30%. We have a 30% rate, which is higher than our peer cities. Another thing that obviously, and we're just kind of breaking down some of the numbers, and we're going to drill down, as we said, a little bit more specifically as we go on tonight. We'd love to hear from you about your concerns about access to health care here in Nashville for a number of reasons. Okay, 737+, by the way, is the phone number. As we look at this, though, what is the next step now that we have this hard data?
So there are a couple of different things that we are doing. We have the data sets are available to researchers if they want to take the data and run it to
Which
see.
Isn't always common, right?
That is not very typical.
Right.
So we are really happy to be able to do that. Making the academic community, let them do some additional cross tabs. Let them look at the data in different ways for, different, demographics, looking at obesity and tobacco use together, amongst the different ways that we have the data available. So that's one way to see if there's something else that is out there that we don't know. But then also just making it available to people who do work in all of the areas that are covered in the survey: mental health, tobacco, health access, insurance, so that this information, because it is available at the sub-county level, then people who do program work can use this data to target those programs and go to those populations in those locations that have need.
And that could be city programs, it could be nonprofits across the board,
yes.
right?
And that's the key point for us to be able to move the needle in health and improve our population health. It takes a community. It takes private, public, government, non-governmental entities, and that's what we are hoping that this does. It's using these numbers to shape the programs or the interventions that you have. And so yes, we do have a lot of local researchers that are looking at the data that we think will provide more information. But Tracy is also leading a community health assessment and community health improvement plan, and this is going to feed into that for the next few years, which is where we're coming up with targets, goals, and tactics of how we are going to improve. So all of these numbers that we see will feed into what things we decide to do in the next few years.
And it really does cover a lot, as you mentioned, Tracy. I mean, not only obesity, tobacco rates and vaping, mental health, which is crucial, how social determinants influence health and well-being in Nashville. And it goes through a number of things, the opioid crisis, and also how Nashvillians access medical care. This is interesting. Uninsured Nashvillians, they report significant barriers to seeing a physician. Almost 55% did not take prescription medications because of cost. 60% of the uninsured face cost-related barriers to obtaining care. So obviously, even though 90% say they currently have health insurance coverage, among those who don't, that's an issue that needs to be addressed, correct?
Correct.
Yeah.
Correct. There's not one organization in Nashville that is responsible for any of this. And so it takes everyone working together, and we'll do our part, and somebody else come to the table to do theirs.
737+ is the phone number, everybody, if you'd like to call in and give us your concerns about how you think the Nashville area is doing when it comes to health and health care. And we're going to share some more of these numbers with you and get a little more detail when we come back. Open Line continues right after this. Stay with us.